Most couples look forward to retirement, spending their golden years together while indulging themselves in their favorite hobbies. But for some couples, the reality is much different. News 8's Martha Koloski now joins us with this News 8 Investigates report.
Mike, Tommy and ElaineWuestwere, married for more than 50 years in La Crosse, had their retirement dreams crumble when dementia changed their lives forever. Here's their story as News 8 investigates the long goodbye.
Married for 51 years, Tommy and ElaineWuestwere of La Crosse enjoyed their 2 children and 3 grandchildren together. But a trip to Hawaii in 2012 to visit their son sparked the beginning of a long and difficult diagnosis.
I noticed that she was struggling. I couldn't leave her alone.
Tommy has worked at Gunderson Health System's mailroom for a dozen years.
Okay.
It's just a different kind of sample.
Okay. All right.
Thank you.
We'll get her delivered.
But even working this closely to doctors and nurses every day, he had a hard time finding the right care and diagnosis for Elaine.
Especially for Tommy and his wife, there were a lot of visits to the emergency room, but really not getting him into the system where they could get some help.
They have a plan for heart people, they have a plan for knees, they have a plan for everything, but except for dementia.
There have been many instances over my career where someone came in and I had no idea that there was any cognitive decline at home until family said, "Boy, you know what? We've noticed a few things. Can you check that out?"
In fact, according to the Alzheimer's and Dementia Alliance of Wisconsin, an estimated 5.4 million Americans are currently affected by Alzheimer's disease. With such an increase in the number of people needing memory care, early diagnosis is important, and family members can be the key in a patient being diagnosed sooner.
One of the most important things is that family members need to communicate with their loved one's primary clinician. So if there's a concern, you know what? Send a letter. Call ahead of time.
But Tommy's efforts to get Elaine help were failing.
Dementia is considered a mental health issue. So when you take them into the emergency room, if they can't find anything medically wrong, they send them home.
Tommy wrote letters to the hospital's administration to let them know that people like Elaine were falling through the cracks. His efforts have helped to bring change here, including healthcare providers using a simple 1-minute test to help detect memory loss.
Our geriatricians and our memory disorders specialists, they really have kind of said, use some screening test. We don't care which one you use, but use something to identify who is at risk in people where there's a suspicion. And so one of the things we've done is we've gone to the mini-cog.
The mini-cog is a simple memory test of words followed by asking a patient to draw a clock face. The result can be very telling.
I had one person do the numbers straight up and down, 1 through 12, and circle 2 and then 4 and 5 as the time. That's how bizarre sometimes it is.
But even after a patient has a diagnosis of one of the many forms of dementia, the wait in La Crosse for memory care can be 2 to 3 months. For Tommy, keeping Elaine at home was more than just difficult. It was becoming dangerous.
And she would hit me and kick me and bite me, and it was totally out of context with her. And it was, when people were around, she was fine. But the minute people left, it turned into a disaster.
Eventually, Elaine ended up here at Eagle Crest South in La Crosse, which Tommy would tell you was a blessing. However, memory care isn't cheap at $5,000 a month. That meant Tommy had to sell the family home and keep working to pay the bills.
Howdy.
But Alzheimer's disease took its toll on a lot more than his retirement funds.
After 50 years of marriage, the only way I could get my wife help was for her to do something either to harm herself or somebody else. And she got upset with me. She took a swing at me. She kicked me. And I had no choice but to call 911. What an ugly thing, after 50 years of marriage, to have to call the police to get your lovely wife help.
On June 27th of this year, Elaine's struggle with dementia came to an end. although Tommy feels like she's been gone a lot longer.
Sometimes it's hard to love someone who's unlovable, but the person that I didn't love was not my Elaine, it was the other Elaine.
And even though Tommy has to move on without her, he has faith they'll see each other again.
She's not going to remember me as a husband, she's going to remember me as a great friend, and we're going to be able to walk together.
Well, you know, Mike, since Elaine passed away in June, Tommy has really become an advocate for caregivers and patients with dementia, just to make sure he gets the word out about how they can find help. And on one more personal note, he just recently talked to his kids about getting a different apartment because he wants to find one that allows cats so he can get a kitten for a little company himself, and he does plan to name her Lainey after his late wife.
Oh, that's great to hear.